I'm Virginia and I've been a medical copywriter and content creator since 2020, and I was a pharmacist in London for about 6 or 7 years before that. So in this video, I want to talk about whether or not you need native English for medical writing. So I get this question a lot because people are worried that because they don't know English in a native way, then they're not able to get the medical writing jobs that they want. But you don't really need to speak native English to write native English. And honestly, I'm not a big fan of the word native because anyone knows that you can be born anywhere in the world, and it just means that it's like your first language wherever you're born. So it doesn't mean that anyone who wasn't born there or who doesn't speak that way can't learn the language. So, for example, my first language was Arabic, and then I was brought up in England, and even my English is not perfect because I didn't study English like to a degree level. So I don't have C2 English. And I would say that if you have like B1 or B2 English, then that's awesome. So you can be a medical writer. So English is useful if you want to write in English, but if you can write in a clear way with good grammar and also write accurately as well, because this is medical health information, so it needs to be actually accurate because it's going to affect the patient. So it's so important that you actually understand the words rather than trying to be native, whatever that means. So I am probably an example of someone who has English as I would say my second language, even though I was brought up in the UK in the English education system. I still have some bad habits when it comes to grammar, even spelling and saying certain words, because there's a little bit of a cross connection with Arabic. So, these are things that you improve with time, the more that you write and the more that you spend time communicating in English. But if you can speak English, you can write in English, and you also have another language that you can speak and write in, then that is like a superpower. So don't discount yourself because you have a different language other than English. So you also want to be able to reach those people that speak in that language because they might not know English too. So even like a lot of the projects that I've done, we've often written something in English and then we've gone to a translator to get it translated into like 10 different languages because the population mix in the UK is so diverse and there are lots of people from different backgrounds and different cultures and they all speak different languages. So there are opportunities if you do not speak English perfectly or native, then you can still write. So if you want to improve your English for medical writing, then spend lots of time reading, spend lots of time writing. And that could even be that you are just writing out sentences from a book that you are reading, because that means that you learn sentence structure, you learn the words that you're writing. And also, if there are any words that you don't understand, you should look them up in the dictionary as well so you can learn about them. And there are editing tools that can help as well. So when I was using Grammarly for the first time in 2020, that really helped pick up some of my bad habits, especially when I use the word that in a place where it's not needed. So also sometimes my sentences can be quite long, so it encouraged me to, make them a bit more readable and things like that. So I recommend that you do have some kind of editing tool to help you to improve your writing. And of course, there is AI as well now. So this is a tool that wasn't available 5 years ago when I started. So if you want to improve your writing, then try to use AI as a tool, but not AI on its own, because AI is a mixture of lots of different types and styles of writing. So you only really get the most out of AI if you can give it a good prompt. And so a prompt is like an instruction. So for example, if you want to learn how to write English and you are someone who speaks Spanish, for example, then you can say, I'm a person who speaks Spanish. I want to improve my English. Please, can you help me, write better sentence structure, or give me some exercises to do some better sentence structure. And so hopefully it can help be your teacher in that sense. And then, of course, there are specialist language courses. So you can go and check out courses which are actually made for people who want to learn medical English. So I recommend you have a look at that. And I would say that obviously sometimes people will ask you on a job description or a job application if you can speak English or native. And it really frustrates me because, that can often be something where they decide, okay, they say yes or no, and then that's the decision. But, still apply for those jobs anyway, because people speak English to different levels. And then also, this is another reason why, if you have a writing portfolio, you can show the level of English that you can write to, and also you can show who you can write for. So lots of different audiences. So always have a portfolio if you can. And I would also recommend that, most clients will care about the quality of your writing, not really, if it's native or not. So it's important to keep that in mind. It's always about the writing, not really about speaking, even though communication is really important. So try to get feedback from other writers. Try to find a mentor if you can and learn from them. Maybe take their courses, read any books, or read their newsletters. If they have like an email newsletter, sign up to that. Read their LinkedIn posts as well. So make sure you follow people. And, every time you read something, you get a sense of the kind of style of the person that's writing. And if it's something that you like, then you can make it your own. You develop your own style as well. And it helps you to build your confidence as well. So your expertise matters a lot more than your native language. So the answer to the question is no, it shouldn't matter if you speak native English or not, if you want to become a medical writer. And I hope this video has given you some confidence and also some guidance on how to improve your English, and especially English in the medical and health world. So thank you so much for watching. I will leave links to some courses if you want to have a look in the description box below, and I will see you in the next video. Bye.